I know that this has been a tough time for everyone. We're all, whether we've been infected with the virus or not, all of us have been affected by the pandemic. But few people in our community have been affected and involved in the pandemic like healthcare workers. We have with us today Dr. Murphy from Mercy San Juan Hospital, who is the director for the ICU. Do I have that right, doctor?
Yep.
And as we know, the ICU is in many cases been at the very crux of trying to save lives during this pandemic. And like just to Dr. Murphy, if you could just share a few thoughts and reflections to us about what these past several months have been like for you and your coworkers.
Well, it's been actually an amazing time, and I would say that because this is the first time, I think, in the memory of any healthcare worker who's working today who has ever come to work on a regular basis with a substantial risk of potentially getting infected and dying as a result of their, work. We had a little bit of this back, 20, 30 years ago in the AIDS epidemic when we really didn't understand that well. But there was no realistic, there was no realistic chance of getting infected with AIDS, frankly, on the job. But here, there certainly is a real problem, and a number of my partners and many of my nurse colleagues have gotten infected. So that's been a real, challenge. But to be honest, I think the major challenge of this experience really has been for the patients and their families, and the fact that as these patients were dying, many times their families were not allowed to visit, and the healthcare team and predominantly, the nurses had to assume that role and to provide, some comfort and, human touch for the people. And that really was just a remarkable experience. And the other sort of amazing thing about this disease is that many of the patients who suffered were often, healthy people who were doing well, and then a week later, they're in the ICU on death's door and totally, ill-prepared to deal with the, emotional and spiritual challenges of their situation. And it kind of reminds me a little bit, and I've been working for a while, but I wasn't around in World War I, but they always said, there's no atheists in the foxholes. And I will have to say that, I'm very impressed by the service that, Father Uba and our chaplains and the nurses and all of us, provided to these patients who often, requested, spiritual services. And realistically, when it comes to that time, that's pretty much the only thing that's left that allows you to deal with this horrible situation. I've never heard anyone say, gee, I wish I could have worked a little bit more, or I wish I could have had, a few more dollars. And it becomes a very realistic appreciation of, the important things in life, and particularly where I see patients with, a good faith basis, it often allows them to deal with this horrible situation. And frankly, the people who don't have that faith basis, it's a very challenging experience for them. And I'll have to say that I also have seen, tremendous kind of participation, with the nursing colleagues and, our chaplains and many of my physician colleagues as well. It's been a very unique experience.
Well, I think there's always been an appreciation for the men and women in the medical profession and the healthcare profession, but in these times, there's a whole new appreciation for that element of care and that attention and the sacrifices that that many of you are making, so that our brothers and sisters can have the care they need, and that they can hopefully survive this pandemic. But even as you've mentioned, those who have died, that's a tremendous stress and strain to accompany those who are dying and to help them, assure them that they're not alone, and to try to be that presence, not only just of another human being, but that at least, in our sense of Catholic healthcare system, that we can be Christ for someone. And I think you and your coworkers have been Christ for many of our brothers and sisters who've been afflicted with this.
Well, I think you're right. I mean, to be honest, it's a little bit, I was going to say it's a little bit, it's a major big load you're putting on our shoulders to be Christ-like, but, we can certainly always try. But I will have to say that we're very fortunate in the sense that we haven't had to encounter the challenges that, they had in Italy, where they ran out of supplies. And I do remember reading several months ago where a priest in Bergamo, he was in the emergency room, and he and another person were sick, and he basically said he wanted to give up the ventilators so that this other gentleman who had a family could survive, and he went on and died. And I'll tell you, those would be awfully big shoes for me to try to fill, under those circumstances. But, we have seen people perform at a very remarkable level. And, when you look back at the history of medicine, that's really been typical. When they were building the Panama Canal, thousands of healthcare workers died from yellow fever. And so, we kind of, when you look back at the tradition of medicine, this actually has been pretty common. But we did not expect that we were going to have, these challenges. And fortunately, it's been like any other experience you have. It's been, quite an amazing experience. And to be honest, we have been sort of so busy fighting the battle that we haven't had, maybe as much time to reflect on this as, we will.
Yeah, well, I think that there is, for all of us, there's a whole new awareness of vulnerability and how we are vulnerable. But that, in many cases, just makes us much more aware of our common humanity. And so even in that weakness and frailty, hopefully this becomes an occasion where we actually come closer to one another. You and your coworkers do that on a daily basis. And I want to remind everyone of the importance for us, not only to, as we continue to fight this pandemic, to take all the necessary precautions, but also to unite ourselves in prayer with those who are afflicted, and with those like Dr. Murphy and his coworkers who care for those who are afflicted, and that we pray that God's mercy might give you, doctor, and your coworkers the protection, the patience, and the perseverance that you need for the good work that you're doing. So thank you very much.
Bishop, thank you. And we really do appreciate, all the good work that, the Chaplaincy Services are doing for our patients. I mean, I think we're all trying to fill different boxes in this major, area of need. And, as I said earlier, I think that, the patients who have, a good faith basis, can often fight this challenge a little bit easier. It gives them, the understanding that there's some meaning. And I'll have to say, for myself, it's kind of reinforced the idea that, we do not have here a lasting kingdom, and that, it's we're all moving on.
Well, not only just by what you're saying, Dr. Murphy, but also by what you're doing, that you're a living homily, and I'll say that for you, about you and your coworkers. And I want to assure you of my prayers. And I want to ask everyone who's listening and watching to please go to the diocese website and look for more information about what we are doing to stem the tide on this pandemic, and to walk each day with hope and confidence in the Good Shepherd. Thank you very much.
Thank you very much, Bishop.